Bismillahirrahmanirrahim. Hi all, welcome to my channel. Today we will discuss the topic of diagnostic criteria of neonatal pneumothorax by lung ultrasound. Our objective today, by the end of this lecture, everyone should be know what about the normal lung ultrasound, what the diagnostic criteria of pneumothorax by using lung ultrasound, and lastly, what's the specificity and sensitivity of the lung ultrasound for diagnosis of pneumothorax. Here, this will discuss the anatomy and pseudoanatomy of the lung. Here, if you see the skin and soft tissue, pectoralis muscle, the intercostal muscle, the rib, below the rib, between the pleura and the lung. We're going to the by sonar. Here the first layer, it is skin and soft tissue, then pectoralis muscle, then the intercostal muscle, rib, the pleura, and the lung. By M mode, we found something called seashore sign or sand beach sign. Here, the sand, the lung sliding is a bit as the sand, is the pleural line, and this is the sea and horizon. We'll start by some definition. What mean by pleural line? The pleural line is the permanent landmark of the lung surface. It is appear as smooth, regular, curvilinear or linear, hyperechoic, bright echogenic, thin line. Thickness is about 0.5 millimeter or less. The pleural line is hyperechoic reflection formed by the difference in acoustic impedance between the pleural lung surface interface. Pleural line abnormality including it was either thick, flaring, irregularity, interruption of continuity, or absence of pleural line. What mean by lung sliding? It is the dynamic process feasible at the exact level of the pleural line. The pleural line move in a matter of the to and fro pattern synchronized with respiration. By M mode, it appears as seashore sign or sand beach sign. Absence of lung sliding, it is always pathological. What mean by A line or bump sign? It is the line are situated below the pleural line. The A line is normal static line and smooth, clear, regular. It is a horizontal repetition of the pleural line. The A line are regularly spaced and separated by the skin pleural line distance. The echoes of the A line gradually diminish as they move deeper to the lung field, where they are ultimately disappear. The normal lung by ultrasound characterized by normal regular pleural line, absence of lung sliding, and well-defined A line. May be found B line less than 3 or absent B line. So any A line pattern together with the lung sliding assure the absence of the lung pathology in the area of the lung scan. Here in the bright mode, in B mode in the ultrasound, this is the skin and soft tissue, this is pectoralis muscle, this is intercostal muscle, this is the rib, and this pleural line, and the horizontal, this is the A line. See, it is equidistance between from the skin to the pleural line it is equal to the pleural line to first A line and first A line to second A line. It is the equidistance. Here, the shadow of the rib. There is interesting sign here. If you the reflection of the shadow of this rib and the shadow of this rib and the shadow of the central body of the pleural line, it is it is bad sign. Bad sign. It is indicated that you are in the correct position, and below the bad sign it is the pleural line. Here by M mode they found seashore sign. The lung sliding, it appears as like sand, and this is the pleural line, and this is the sea and horizon. See here, this is the soft tissue skin, the intercostal muscle, pectoralis muscle, rib, bad sign, and the pleural line and the A line. See, this is the lung sliding. This is through movement, to and fro movement with respiration. I am deeply to be. See the movement, to and fro movement. Here again, see the movement, see the bad sign, this is the shadow of the rib, this is the A line, this is lung sliding here, lung sliding. Here by M mode, there is seashore sign, sand, pleural line, and the sand. Now we are talking about diagnostic criteria of pneumothorax by using lung ultrasound. What the benefit of using lung ultrasound in diagnosis of pneumothorax? It is accurate, reliable, result in timely diagnosis of pneumothorax, facilitated the therapy process, no ionizing radiation, easy operation with a short duration. The diagnostic criteria of the lung ultrasound by using of pneumothorax in the P mode, where there is A line, absence of lung sliding, absence of B lines, mirror rib, as like figure 8, absence of lung pulse, presence, there is lung point. What mean by lung point? It is the point between the area of the pneumothorax and the aerated lung and normal lung. If it is present in the scan, it will mean that this is mild to moderate pneumothorax. If large amount of pneumothorax or severe pneumothorax is with no lung sliding. In M mode, we found something called stratosphere signs or barcode sign. Here, this is a normal lung by M mode. This is a barcode sign. This is a mirrored rib. See the rib here, below the pleural line, the mirrored rib, figure 8. This is the area of the ear. This is pneumothorax, and this is normal lung. This is lung point. This is the lung point. See here, this is the no lung sliding. The lung sliding here, there is no lung sliding here. This is a lung point. See, this is lung sliding, this is static, no lung sliding. This is mirror shape rib here, no lung sliding. This is A line. Here, no lung sliding, see some sliding here. This is barcode, M mode. there is lung sliding here. See, there is no lung sliding. This is area of pneumothorax. There is no lung sliding. No lung sliding here. As you see, there is no lung sliding. This is barcode. See, this is lung sliding here. There is no lung sliding in this area. This is lung, what's called lung point. There is no lung sliding here. This is pneumothorax. See, this is static, no lung sliding. Here lung sliding. This is lung point here. You see lung sliding to and from movement, and there is static here, no lung sliding. So the lung point here. Here it is mirror drip. Also there is no lung sliding. See, there is no lung sliding. No lung sliding. No lung sliding. No lung sliding. See the barcode. This is lung point here. This is lung sliding, and there is no lung sliding here. See, there is no lung sliding. Feel some sort here. This is lung point. Here barcode sign. Barcode sign. Barcode sign. See the lung, normal lung sliding after needle aspiration. This is normal after leading aspiration. See sure sign. After needle aspiration, she is sliding. See the sliding. There is no lung sliding here. See, is it the lung sliding here? No lung sliding. This is lung point here. Also here, this is lung sliding. No lung sliding. This is lung point here. Is it the barcode? It is sandy beach sign. This is normal. See here, lung sliding. No lung sliding. See here in the lung point by M mode. This is normal lung. Sandy social sign or sandy beach. This is barcode or straightforward signs. Also here, it is the normal lung by M mode, and this is barcode sign. We'll talk about specificity and sensitivity of the lung ultrasound. This is the systemic review and meta-analysis done in the published in the March 21 this year. Is the make a review for the 528 study. Overall, the specificity and sensitivity of lung ultrasound in diagnosis of pneumothorax, it is 98% and 99% in comparison to X-ray as the reference, with sensitivity 82 and specificity 99. As the duration, the median time to diagnosis pneumothorax by lung ultrasound, it was 9.5 minutes, range from 5 minutes to 15 minutes, and chest X-ray, it is median, it is 50 minutes, range from 33 minutes to 64 minutes. The sensitivity of lung ultrasound at the diagnostic criteria for pneumothorax alone was not related to the chest X-ray. It was 98% sensitivity and specificity was 100%. So by the end, the normal lung ultrasound finding, it will be normal pleural line, lung sliding is very important, and A line. By M mode, there is seashore sign. In the pneumothorax, the air, so it will be a lot of A line and the normal pleural line. The only difference, it is lung sliding. In the normal lungs, it is lung sliding. In pneumothorax, there is no lung sliding with barcode sign in the M mode. Thank you. We'll waiting for the next lecture, inshallah. Thank you.